this is in line with the, this is probably the second program in line to the theme of the National Pharmacy Week celebrations of this year. Pharmacists, pharmacists, the frontline health professionals. The meeting now is being streamed live in the YouTube. So in line with the programs, the Indian Pharmaceutical Association Karnataka State Branch has been very pivotal and quite active now in highlighting the efforts of the pharmacists during this testing times of COVID. So we were emphasizing on the role played by the community pharmacists, particularly as to how they have been involved actively in the healthcare chain. So in this regard, we were thinking how to bring into the forefront the activities of the pharmacists. So we thought that the community pharmacists should be given a platform to express the role or share their experiences during this COVID time, how they have actually served the community. So in this line, the state branch headed by the President Dr. K.R.P. Shenoy, Vice President Mr. Amresh Tumgi, Additional Drugs Controller, and again Vice President Dr. Narasimha Reddy, and Joint Secretary Dr. Manjunath. We all have, and all the other executive members. We have identified Mr. Raj Vaidya, one of the eminent pharmacists from Goa, who has a lot of credentials to his credit, and who is a great contributor to. Give me a moment. The YouTube person is on the line. Hello. So we have identified Mr. Raj Vaidya, who holds a lot of leadership positions in the profession of pharmacy, and who's going to be a great contributor for today's program. Also, we have a very young and dynamic officer. I request everyone to kindly mute your mics so that there's no disturbance. Yeah. So we have another speaker that is Assistant Drugs Controller from Belagavi, Mr. Raghuram NV, who's again a very young and dynamic officer who's dedicated himself for the cause of the pharmacists, whom I'll be introducing later. And we have one more pharmacist, the registered pharmacist from Belagavi, Mr. Satish Savade, who's going to share his experiences regarding how, as a pharmacist, he has contributed to the benefit of the community at large during this COVID period. So I formally now request our President, Dr. K.R.P. Shenoy, to kindly come forward and give his presidential note. Dr. Shenoy, please.
On the eve of 59th National Pharmacy Week, which is having a theme, pharmacist, frontline health professional. As Dr. Khan mentioned, this is second in the series of programs what we organized for this year's National Pharmacy Week. And I would like to welcome all the eminent speakers who have, in spite of their busy schedule, have agreed to, come forward and share their experiences, during this pandemic period. And the topic being Voice of Community Pharmacist. I extend a warm welcome to Shri Raghuram, Assistant Drugs Controller, Belagavi, Mr. Raj Vaidya, who is a Chief Pharmacist and partner at Hindu Pharmacy, Goa, who is also very actively involved in Indian Pharmaceutical Association national level. He was Vice President for one of the divisions for several years, actually. And also I would like to welcome Shri Satish Savade, Registered Pharmacist from Belagavi. I also extend a warm welcome to all my colleagues in the committee, that is IPA Karnataka State Branch and the office bearers. And welcome to all the participants from the academia as well as community pharmacists. Actually, during the pandemic period, all the pharmacists, from different, divisions or categories, you can say, have contributed in their own way. For example, you take education. They had to, the teachers had to learn a new way of teaching, online teaching, and they have not stopped the classes actually. They have been conducting classes, they are organizing exams, it's all as usual, like, nothing has changed, except that students are not coming to the colleges. And then, of course, the enforcement authorities have been very active to ensure that the medicines are available to the public, and help the industry with, a faster approvals, and even, in fact, the extending the licensing period, instead of going for renewal, I think they extended the validity of the license, for example, import license, by 6 months. Like that, regulatory authorities also have contributed immensely during this time. And of course, community pharmacists, they had to work all the time. They could not close their shops because they had to provide the medicines to the, public. And industry, lastly, industry has also contributed in terms of keeping the continuity in the availability of drugs in the market. And of course, some of the companies have actively pursued developing or repurposing some drugs for treating COVID-19 infection. And they've also got into developing vaccines for treating as a preventive measure for COVID-19 infection. Okay, so all the pharmacists in all the fields have contributed during this pandemic period. Today, our focus is on community pharmacists. Okay, and as I said earlier, we have 3 eminent speakers who are going to address on these important topic. And without taking much time of yours, because we already started, I think, 5 minutes late. So give opportunity to the speakers to give their experiences. I hand over to Dr. Khan to take it forward.
Thank you very much, sir. Thank you very much for your introductory note, and a warm welcome to all the speakers. I think we have a wide array of audience from all corners, especially from Belgaum, and probably many are on the YouTube channel seeing us literally. So thank you very much, sir. And now I would like to begin the session with the talk of Shri Raghuram NV, Assistant Drugs Controller from Belgavi. Like I told you, is one of the young and energetic, very proactive officer of our department, who has been very active with respect to the cause of the community pharmacists at large. He's done wonderful work during his tenure. Just to brief up about his background, he's done his B.Pharm from Tumkur in 1996, and he joined the department as a junior scientific officer in 1996. Later, in 97, he joined as a drugs inspector. So from then onwards, he's been doing yeoman service to the department as well, in the form of a regulatory enforcement officer, and as well taking care of the community pharmacists issues. So he's also the life member of IPA. So we thought it appropriate to highlight the activities of the regulatory officer, because the regulatory officer has been pivotal when it comes to the community pharmacists and the regulatory aspect and the people of the community. So he's played a pivotal role, the regulatory officer. So I thought appropriate to begin our session today with the note of a very young and dynamic regulatory officer, Shri Raghuram NV. So without much time, I invite him to present, to address the gathering. Mr. Raghuram.
Yes, sir. Sir Kali, sir, thank you very much. And thankful to all the office bearers of the Karnataka IPA. And thankful and I appreciate the IPA Karnataka branch as they selected voice of the community pharmacist, and which is a need of the hour. So IPA recognized service of the participation of the community pharmacist in this COVID-19 pandemic. In this district, we have around 2,000 community pharmacists. It's bigger next to the Bangalore in the area, and even in population, comprising of nearly 50 lakhs population. We have around 13 talukas here. So nearly 500 to 800 wholesalers we have here. So especially community pharmacists in the Belgaum area, they are well aware of the Drugs and Cosmetics Act, and they are frontline health professionals always. In flood affected time also, they have rendered their services like anything. So here this district shares two states borders, Maharashtra and Goa. So many migrants from Kolhapur especially and Pune area. So that's why in Belgaum, the COVID positive cases has been raised. Nearly 25,000 cases found positive in Belgaum district. As of now, we have only 279 cases. So here, these 2,000 community pharmacists will be monitored by 3 assistant drugs controllers, headed by deputy drugs controllers, 1 deputy drugs controller. We enforcement officers, being a professionals, first of all, we motivated our community pharmacists to participate in the government programs, especially. We made our colorful pamphlets by mentioning the importance of wearing of mask and social distancing, then hand sanitization. Each and every community pharmacist, they have displayed our department sponsored colorful pamphlets. I have to appreciate our community pharmacist here. Then, first of its kind from the entire state, we made a one link, Google link, where the community pharmacist can upload the information about the patients who are going to purchase the drugs during lockdown, during this COVID-19. So this idea was floated by our ex-CEO, Dr. Rajendran. Basically, is a medical graduate. It was his thought. In a state level meeting, he suggested to the meeting. So everybody is accepted. So we started implementing this Google link. And with the support of Belgaum Smart City, we could able to make a link as early as possible. Then we circulated among all 2,000 community pharmacists. It was easy that time. So they started uploading the information about the patients and what the medicines they are going to purchase. After that, smart city people trained smart city persons. They used to call the all patients, which is monitored by again a medical officer. So thereby they contacted each and every patient, and again, if any severe symptoms are there, they used to pass on the message to concerned area medical officer. So by then they followed the patient. So thereby our community pharmacists, they help to curtail the spread of the COVID-19. So further, sir, in this community pharmacist, so there are inaccessibility for the service providers, especially doctors, homeopathy doctors, then allopathy doctors. They were not practicing at that time. So really, our community pharmacists, they did a wonderful job. They started counseling the patients. So they take an entire burden of the patient on them. So then they started screening the patients. They have played various role in supporting the healthcare system during COVID-19, delivering medication to the patient, educating the patient. Like that, they have done a wonderful job, sir. So then afterwards, one issue came. After success of this Google link, we forwarded the same thing to our state body. So state body, they came with a state level portal. So we started adopting the Google link to the state link. There we got some problem in through the department. Again, we made a one call center and helpline where the trained people, they trained our committee pharmacist how to upload, how to make the things easier in the state level links. So during this time, we faced one problem in remdesivir injection. So again, there was a short supply, especially to the North Karnataka. We contacted our colleagues at Bangalore level. So we got the distribution details from them. And here in Belgaum, as per the directions of our drugs controller, we started motivating the marketers of the remdesivir, where they gave the advertisement in the local print and electronic media availability of the remdesivir. So by that time, we solved that problem. Again, sir, enforcement officers, being a member secretary of the medical oxygen committee, we played a vital role. We monitor the entire medical oxygen supply, starting from allotment at Ballari, Praxair, or some other these things. Allotment, filling, as well as supply chain. We have to monitor the things. So we have monitored and we have done it in a smooth way. So that is much appreciated by our district administration. So we work like a frontline health workers, as good as district administration, DHO, medical officers, civil hospital directors, like that. So these are the things, sir, I have to elaborate. So about drug shortage, sir, there was no drug shortage during the lockdown or COVID-19. Delay in the service was there. Even though we maintained the service of the drugs in the right time, especially there was a problem with psychiatric medicines of mentally challenged patients who are treated at Dharwad Mental Hospital. So we have seen that the medicines supplied through the ambulances. So that as an enforcement officer, we done the availability of the drugs at the right time in the pandemic this thing, sir. So these are the points I want to elaborate in this webinar, sir. So I thankful to Khan sir. He has given the opportunity to share my thoughts in this forum, and also he has given the chance to community pharmacist of Belgaum especially. So thank you, sir. Thank you very much.
Yeah, thanks a lot, Mr. Raghuram. Been a wonderful insight. You have given a very good insight into how the drug regulatory department played the pivotal role between the community and the community pharmacists. So it's been a wonderful experience for all of us. In fact, the entire department throughout the state was very active, linking the emergency services and the community pharmacists and the distribution of medicines and all those things, starting from masks to sanitizers and to all the critical medicines like tocilizumab and remdesivir, etc. So thanks a lot for your insight. In fact, we will be conducting many such programs, taking each and every district into our confidence and giving them an opportunity. In fact, community pharmacists are the key players, like the National Pharmacy Week theme, that pharmacists are the frontline healthcare professionals. We would like to really showcase that we really are the frontline healthcare professionals, and it is not just a theme that an organization has given. So that is our aim. So without wasting much time, I would like to invite the second speaker, or eminent speaker of the day, again, a very experienced community pharmacist who has been very active in his district in Belgaum, serving the community. So it's really, IPA is fortunate to have such pharmacists in their fold who contribute a lot to the profession and the professional organizations also. Mr. Satish M. Savadi from Belgaum, who is a registered pharmacist, is in Gauri Medical Stores in Belgaum. He is also a partner in Shamsri agencies, and he is involved in various community pharmacist programs, continuous education programs in elevating the professional needs of the pharmacists there at Belgaum. I think Mr. Savadi is going to give a very good insight into how the community pharmacist is playing a key role in the healthcare professional chain. So kindly come forward, Dr. Satish, Mr. Satish Savadi. Thank you.
Namaskar and hello, all my respected community pharmacists and other dignitaries, sir. I wish you a very happy and healthy National Pharmacy Week celebration 2020 being organized by Indian Pharmaceutical Association. I have to thank IPA for two reasons, sir. Firstly, you have invited me as an echo of my community pharmacists' voice here in this territory, that is Belgavi district. Second largest district in Karnataka with reference to number of licensees. Secondly, the theme, the very genuine theme what you have affixed, that is pharmacists, frontline health professionals. Yes, this is not a slogan just to sound in air or talk, but it is a fact on the ground. Instead of giving boasting or a boasting oration, let me present with documental or evidential justification for the theme provided by your kind self, sir. I want to add up a PPT. Grant me permission, sir.
Yeah, I think you can share the screen and start.
Yes, sir. Yes, sir. So my speech should not be a boasting speech. It should be justified, and it has to be revealed by my colleague pharmacist. Sir, my screen is clear to you?
Yeah.
Thank you, sir. So we are celebrating National Pharmacy Week 2020. And the theme is very genuine and a very essential theme affixed by you, sir. That is pharmacists, frontline health professionals. And I am representing, or I am an echo of the voice of the community pharmacists in our territory, that is Belgavi. I have to thank IPA for such a needy and genuine theme. And frequently we have proved this, sir. My colleague pharmacists, community pharmacists have frequently confronted disasters. Of course, I am supposed to talk about COVID-19, but a little enhancement is required because the whole year we have suffered. We were basically suffered due to heavy rain and flood effect. At that time also my community pharmacists, with the kind help and assistance from the Karnataka Drugs Control Department, IPA faculties local, KSPC, various pharmaceutical organizations and various educational institutes, especially drug department gave us a socio-legal framework. They were assisting us regularly, they were monitoring us, and they were boosting us to confront the situation. With all these helps, as a community pharmacist, as a registered pharmacist, recently we are called as counselors. We are implementing counseling also. We are dispensing pharmacists and we are community health providers. With these designations, we were able to cope up with the situation. I just want to give an example of the disaster, flood disaster, how my colleague pharmacist has suffered. Similarly, I can highlight on the right side how departmental officers, drug department, KSPC and other organizations, they were not working as officers, but they were family members of the victims. In this way, the faculty members of IPA, educational institutes, drug control officers and staff, they participated, they motivated us, they gave us a proper track so that we were able to rescue our community pharmacist, my colleague pharmacist. This is an example and of course a justification for the flood disaster management in my area, that is Belgavi district, sir. This is an example, a justification how the theme, the holy theme, pharmacists are the real frontline health professionals. This theme is backed by our drug control department. Officers were actively engaged in rescuing our colleague pharmacists, especially to rehabilitate them so that community would be fastly and successfully rehabilitated. This is another justification, especially about the pandemic, that is a COVID-19 disaster, national disaster. I have to thank Drug Control Department, KSPC, various organizations, education institutes, especially IPI faculty members here in Belgavi district. They gave us framework. Secondly, the pharmacists, both at wholesale level, retail level, and our staff were given ambulatory passes so that our movement would be authorized. We were taught, we were tutored to use protective measures, and we were given other suggestions. In turn, we were able to use these protective measures. We were digitally and personally monitored by all these dignitaries so that we were able to use mask, sanitization, social distancing, and in turn we were able to render our service at the doorstep of patients and their dependents. We could encourage patients, we could re-educate them about the wearing mask, sanitization, the social distancing, especially above 60 years of age and less than 10 years of age. Those two category of our patients, our customers, were given a lot of information by the knowledge what we gained from the kind information provided by the Drug Control Department. Lot of precautionary suggestions were given to us, and in turn we imparted this to our customers. When the whole country was almost locked down, when clinics were closed, when laboratories, pathological laboratories were inaccessible, we community pharmacists in our Belgavi district conducted blood sugar monitoring tests in our counters to the needy people. This is an obedience to the theme, pharmacists are frontline health professionals. Most of my community pharmacists conducted BP testing also in our own counters by keeping all the precautionary measures. Apart from our professional service, my dear colleagues, respected officers, I want to bring to your kind notice that most of my colleagues have participated in social welfare activities also, like my community pharmacists, along with local police officers, local social workers, and Air Force officers, family members. On left side, you can see professional participation. We have participated in distribution of sanitizer kits and immunity booster kits like Chyawanprash and all to the Swachhata Karmachari of Belgaum City Municipal Corporation. This is an example of the justification of the theme, whatever you have affixed for this year 2020, sir. Lastly, the theme is being frequently proved by our colleagues, my colleague community pharmacists. Always we are maintaining first aid kits, we are attending roadside minor accidents, we are attending domestic injuries, and we are always proving the theme, we are always adhering to the theme, justifying the theme as first aiders. And in this way we are recognized, and we are our service was properly identified by the community. Lastly, I have to thank for inviting me as an echo of the voice of the community of pharmacists, community pharmacists of Belgavi district, with the kind guidance from Drug Department, KSPC, various educational institutes, IPF faculty members, and pharmaceutical organizations. Secondly, I have to thank for a genuine theme needed, not only to Belagavi or Karnataka or India, but for the whole world, which has to be properly yet to be identified and recognized as pharmacists are frontline, real frontline health professionals. Thirdly, I have to thank for recognizing pharmacists as real COVID warriors confronting the conditions or the situation like disasters. We always ensure, we frequently assure, we will always justify our profession with reference to this theme, sir. So once again, I thank all of you for giving me an opportunity to interact and reproduce the voice of my colleague pharmacists here. Thank you. Stop share. Voice clear ಇಲ್ಲ.
I'm so sorry. I hope I'm audible now. Yeah, thank you very much, Mr. Satish Savadi. You have given a very great insight into the activities of the community pharmacists in particular as to how they have played a very key role, whether there is an emergency of floods, there is an emergency of any other disaster, particularly the present COVID situation. Let me also tell you that the hard work of anybody, for that matter, doesn't go unrewarded. And your hard work for all these years has definitely been rewarded. Rather, you may get more such platforms to share your work experiences, and definitely you are a role model and an inspiration to other budding pharmacists who want to take up community pharmacist as their profession. So thank you very much for your great insight and very positive outlook with respect to the role of community pharmacists. Thank you again. So without wasting much time, I would now invite our last speaker, a very eminent pharmacist from Goa, Mr. Raj Vaidya.
Yes, sir. Hello to everybody.
Yeah, give me a minute so that I can introduce you to the audience. We have a great set of audience. All the pharmacists from the whole district and probably from Goa also, and from whole of Karnataka state have joined us. Are very keen to know your background. Mr. Raj Vaidya has been a very eminent pharmacist all these years from the state of Goa. He is a chief pharmacist and a partner in the community pharmacy there in Goa by the name Hindu Pharmacy. He has held a lot of leadership positions, I should say. His profile rolls into more than a page. So I will be short listing and highlighting the important things so that I do not waste much time, and I would like to give him more time to address the gathering. So he holds the vice president and the chairperson community pharmacy division of Indian Pharmaceutical Association. He also held positions of secretary, treasurer, and executive member of the Indian Pharmaceutical Association state branch of Goa. He was also the vice president, Goa State Pharmacy Council, the president, Alumni Association of Goa College of Pharmacy, chairperson of Institutional Review Board, Sangat, and he's also the editor of the IPA CPD Times, E-Times, of the editorial of the Indian Pharmaceutical Association. He's been a project leader for pilot project on accreditation of pharmacies in India. That's again a WHO program. And he's been the project leader for project on good pharmacy practice. And the Indian Pharmaceutical Association in collaboration with the DCGI and WHO have taken up this. So he's been a member of core team which drafted the GPP guidelines, that is the of the Indian Pharmaceutical Association. And he's been the member of the National Advisory Committee for engaging community pharmacists in pharmacovigilance. Let me tell you, this is a very key area where the community pharmacists have been playing a very key role with respect to pharmacovigilance program. Probably in our future programs of IPA, we will highlight the role of community pharmacists with respect to particularly the pharmacovigilance program, where Mr. Raj Vaidya has been the National Advisory committee member. And he's also holding various honorary executive positions in various health and disability related NGOs. He also has some awards for his credit. He's a Young Achievers Award of IPA 2005, Hero for Health Award Southeast Asia. He's IPA Fellowship Award of IPA 2007, and Father Tong Memorial Centenary Award of 2015 by the Voluntary Health Association of India. He's been a member of various other professional bodies. So I think with respect to the theme of the National Pharmacy Week and the title of today's IPA program, that is the Voice of Pharmacists, I think we have a very apt speaker for us who's going to highlight the role of the community pharmacist. Kindly come forward, Dr. Raj Vaidya.
Thank you, sir. Thank you for inviting me to share my experiences, and I welcome and say hello to all the fellow pharmacists who are attending today. It is indeed my pleasure to be here and share some of my experience. So I have been a frontline warrior. I have been on the ground in my pharmacy. And I will share some of the things that we experienced and some of the common things which others experience. Now, this is my pharmacy, a family-owned pharmacy, which was started by my grandfather in 1911. And then my father was also a pharmacist, who was there for more than 50 years at the pharmacy. And now my wife and myself, we are handling the pharmacy for the past 30 plus years. We have different sections: allopathic, Ayurvedic, homeopathic, and veterinary. And we have around 25 staff having 6 pharmacies. We have quite a busy place with almost 500 walk-ins every day. So the initial lockdown created quite a panic in everybody from 23rd. And in Goa, what they did was that for the first 3 days, they did not allow even the grocery shops and vegetable shops to open. All the load came on us. So people rushed in for many things which we generally don't stock in abundance. So right from milk powders, biscuits, toilet papers, pet foods, and of course for the demand for masks, sanitizers, etc., all went up. That also we had always had in limited numbers. This was quite unexpected, and I think for everybody. And even the stockists had all these things in short supply. Now, when the lockdown was announced, all the public transport came to a halt. And with that, what happened? That more than half of our employees, staff, could not come to work. And in another 8 days' time, the first 3 cases were detected in Goa. As soon as that happened, our strength reduced further by half. This is because of the fear psychosis among the staff, the family members, and general panic that was going on. So what the first thing we had to do is to reduce our timings. We had to shorten our timings, and because we were less in number and we had to handle quite a crowd. This was everything new for us. People standing in a queue, long queues outside. Then down photo you see we are having different papers posted, because we had to make our own posters with using computers about mask and safe distancing. We had to make makeshift arrangements for making barriers. So right there we have put 2 sofas across the counter so that people don't come forward. So initially we had to do with these things. So the chaos and panic was there all around, and there were police at the barricades, which did not allow people to move around, as must have been the places, many places. And unless the police were convinced about the people going out for medicines, they were not allowing them. And sometimes even our pharmacy staff was not allowed to come to work. So we had further problems. So much so that the CRPF battalions were called in to further enforce the lockdown. Our place is in heart of the city, my pharmacy, and it's always busy. You never get a parking over here. But for the first 1 month, this was the situation outside. Everything empty. So there were medicine shortages, especially for the first many days, because people started buying in panic. People wanted to buy more and more. And secondly, the stockists also had some problems because of shortage of staff. They also had similar problems. and delivery was difficult, and stocks were also a problem. So in those days, the home delivery of medicines, we started getting more and more calls. People wanted medicines to be home delivered because the elderly could not get out. People had panicked. And on 26 March, the health ministry notified that a pharmacy could do home delivery of medicines, of course, under special conditions, even for Schedule H medicines, that I think all of our pharmacists know. So this was another method we used so that patients don't have to feel like when they come here that they are sure that the medicines are available. There was also an app, breeze.in, which we also used so that patients could log in and find out whether the medicines were available with us. So it saved them their trip, or they could send us the message so that we could make it available for them. Now, this is our patient care area in our pharmacy. Our pharmacy is quite big, and our patient care area is around 15 square meter. Every day we get around 100 plus patients only in this area for their blood pressure checks and blood sugar checks and body mass index and counseling and nutritional guidance. But what happened in the lockdown, right from day one, we had to close that area. It's actually a very popular and busy place, this particular section. First, there was shortage of staff. And then what happened is that the fear of COVID, because of that, we had to close this situation because people are unfortunately, people are still not following properly social distancing. People are still not using their mask properly. So the fear is still there, but at the same time, people are not taking things seriously. So our this particular patient care area, unfortunately, we have still not been able to start because of these reasons. Because suddenly COVID goes up, it goes down, and then there is fear everywhere. So in the initial stages, just with a handful of staff, we had a very tough time handling a huge rush of customers with just few staff, and so naturally fatigue did set in. So at the same time, I salute all my staff for being there, whoever were there together, and for their camaraderie. And in spite of all the difficulties, in spite of some of them pressures from the home not to go to work, they were there and promptly attending and taking care of customers. And over the next many days, then various pharmacists and stockists brought this problem to the notice of the FDA and the collector department. And what they did was that they started sending out letters and urging through the media for the staff of essential services to join. Some of the appeals set out by the collector, south, north, even chemists were then authorized to give letters to their staff so that they could be permitted to work. But there being no public transport, many of the staff still could not come to work. Now, the only public vehicles which were moving were the government buses which were ferrying government staff. Now, on these buses, our private staff were not allowed, even though the government said, okay, healthcare staff could be permitted. Now, this is a WhatsApp conversation in which in charge of this public fleet of services says that pharmacy staff does not come under healthcare services. So that is why we cannot allow your staff to come. These were various difficulties. Slowly, eventually, a month down the line after COVID started, around April 20th, more and more of our staff were able to come to the pharmacy. So everywhere, new things, new norms were in place. And we had to convince the people to start wearing the masks. And initially we had to make these printed computer printouts because in those days everything was closed. The carpenter was closed, the printers were closed, everybody was closed. So we had to get used to this. Then a month down the line, when the painter and the carpenter were available, we had to get these things in place. These are the barricades that we built. On a Sunday, we called the carpenter and made this barricade, which are still there now. We did not imagine that they would be needed, but they are still, and maybe we will still need them. So that there is a distance between the patients and our staff. We had to update our staff. So we had to guide them, keep them under aware about the hygiene measures, about how to wear masks, because it is but natural that everybody touches the mask. So we have to keep reminding them, keep sending them WhatsApp messages on our group, and also to have group discussions and time to time information, circulation of notices. These were the printouts we made for our staff to sit and read, so that all the guidelines were written in that. And we had in between staff training, so that everybody was time to time reminded what care they should take. Now, in spite of everything and all the precautions that we took, COVID finally did catch up with us. So in September, many of our staff were affected with COVID. Majority of them were asymptomatic, but since one person got symptoms, we had to get the other people's checked out. So we were closed for 5 days, and the next 2 weeks, just 4 or 5 staff were tested negative. They could come, and it was really difficult for them. And it's hats off to them that to manage to handle the huge crowd that we generally have with just few of them. And across the country, similar situations have been there. For everybody, it's a new thing. And all the chemists, pharmacies have come together in facing this challenge. I think huge number of places have been closed, but it's only the pharmacies who have been open throughout. It's only the pharmacy staff who have been constantly on the front line, battling and serving the patients and making their needs met. Different measures have been used by different pharmacies, depending on, sometimes the pharmacies are very small, so customers have to stand outside. And different pharmacies have gone through different phases based on the situation around them. Many of them, staff have not been able to come sometimes, or some other times. There have been restricted timings. Some pharmacies have been in containment zone, where some cities have been very badly affected, and in some cities have very strict lockdowns. Lot of difficulties. There have been difficulties in getting supplies. There have been ups and downs in the customers, the number of customers, in the sales, and some of the staff, the pharmacy owners, they have been overworking. And of course, unfortunately, many of the pharmacy staff have got infected. They had to be quarantined. Family had to be quarantined, hospitalized, and unfortunately, many of the pharmacy and pharmacy staff have are no more with us. Pharmacies had to be closed because of these reasons. So a lot of news has been going around over the last many months about medicine supplies, the shortages of medicines. It was bound to happen, and a lot of, unfortunately, misinformation also was there. And in some localities, the FDA and some of the district administration and sometimes the police also had to issue orders that no pharmacies could sell OTC medicines for fever and cough and cold, because otherwise the number of detections were not coming in and corona could spread from patient to patient. The pharmacies were under a strict watch, and they had to send in daily reports to these departments. And these were some of the notices put out. I think this was in Pune. In Goa, we did not come to this situation, because Goa was in the green zone for quite a long time. But of course, then it became bad. Pharmacies had to send in their daily reports about the medication they sold for fever, cold, and cough, and the patients that they saw with these symptoms and their details. So hygiene naturally slowly started building up with all the pharmacies. Even our pharmacy, I can say that everybody had become hyper for hygiene, washing the hands again and again. Any parcel received from the distributor was kept away for a few hours, sometimes half a day. Some parcel which came from out of town, we had to keep them away for one day. This was all built-in measures, because there was a lot of uncertainty. There was a lot of information flowing in, sometimes this information, sometimes contrary information. A lot of additional protection, especially in containment zone, lockdown zones. Pharmacists have been using PPE kits and gloves, face shields, goggles, and many of them have put up acrylic shields in front of them, have made their own types of barriers. have made own types of devices. This is the use of a swing where the basket is used so that minimum distance is a lot of distance is maintained between the customer and the patients. Now, all this was maybe on the verge of coming, and COVID has also shown us that there is another problem in the world. India is also one of the hotbeds for that. It is antimicrobial resistance. A lot of antimicrobial, antibiotics, as well as the antiprotozoals, etc. A lot of them have developed resistance over the years. So this is not a pandemic which can be seen or which we are witnessing now, but it is something for the future. I think COVID has rung that bell, the warning bell for us, that health and hygiene is very important. Personal hygiene as well hygiene of our surroundings. So this is what we have to go forward with, because the more hygiene we have in place, the lesser will be the infections that we will have, and the lesser will be the need for antimicrobials, and lesser will be the antimicrobial resistance. That of course is a separate chapter to deal with. And of course, all of us have been with these various uncertainties, and a lot of medicine demands, ups and downs, and hoarding of medicines and short supplies, different medicines being prescribed in turns, and ultimately then final verdict comes out that no, it's not all that effective. So all of these medicines have been given emergency. Many of these have been given emergency approval for treatment of COVID. So that also we have been through all of this, and there have been, and there still remain uncertainties in pharmacies in our country. Will my home or pharmacy again come into a containment zone? Will there be another lockdown where I stay or where my pharmacy is? And when will this problem end? And for how long do we live with this problem? And then there is information that there are more viruses. Will my staff or me get infected? What about my family members? Been the fears, but the pharmacists have stood their ground and have been facing reality and facing the flow of customers and giving them their services with a smile, in spite of so many being tested positive. This has been regular news items. So we should, of course, we all should, and I'm sure the public also salutes all the COVID warriors amongst the pharmacists, the pharmacy staff, and all of those working in community and hospital pharmacy who have worked tirelessly during this pandemic. And we, I think, along with the other healthcare staff and of course the policemen and the other health workers, have not been at home. They have always been at work. It is always a pleasure to serve our country. So many of the newspapers, media have given the due credit to the pharmacists, much deserved, about home delivery. How pharmacists have been effective in delivering medicines to the homes of patients when patients were not able to come out of their houses. And this was a time when uh, parcel services, postal was there, courier services were locked, and online services of pharmacies were not able to function. Now, a few months back, the government announced a 50 lakh insurance for the frontline warriors. And of course, all the retailers and wholesalers in the country and the staff were disappointed that pharmacies were not included, pharmacies and their staff were not included in this scheme. There was also a disappointment that the pharmacies were not getting equal praises like the other frontier workers. But of course, in spite of all this, we all know that we have done our best. The public knows that we have done our best. And it is finally our benefit is the due credit that we get from everybody. And of course, there was then credits coming in from different pharmacy councils, different pharmacy associations, and finally different companies who also started acknowledging that yes, chemists and pharmacists have also played their role in the front line. These are different advertisements issued by different pharmaceutical companies, and there's some from the newspapers and some from the different politicians. Yes, pharmacists have got their due credit, and we have to continue to do our best to serve. So the information material from AIOCD about masks and hygiene. Our challenges still continue. They have been and they still continue because people have now got used to these new modes. We have been receiving prescriptions across the country, of course, prescriptions on the mobile phones. People have their own excuses and reasons why they are not able to produce the hard copies. Because the patient is at home, doctors are not available. Doctor has told on the telephone to, yes, you continue the same medication. And there have been now the system of having teleconsultations, where the prescription is sent on teleconsultation to the mobile of the patient. Now, what happens when a Schedule H1 or a sedative or an anti-epileptic medicine is sent on by such teleconsultation? We in our country do not have a system in place. So when one such prescription comes on the mobile, can this same patient go to different pharmacies and get the same medication in more and more numbers? This is a big risk which can also be there. There is no sure short system of what needs to be, what can be done, how pharmacists can ensure that this prescription is genuine and it's not dispensed more than once. Then there is the home deliveries, then the challenges of counseling and talking to the patient. Now, for the first three parts, there needs to be some legal norms which need to be put in place so that we are on board, that we are able to follow the law. At the same time, we are able to do justice to the patient. This needs to be handled well. So the uncertainties continue about misinformation being spread, about the virus, and then about the vaccine. So vaccine is now almost there at our doorstep. There also we have a very vital role to play. And whether now there could be a second peak or a third peak, because in some places schools reopened and again had to be closed. So a lot of then unfortunately Delhi has gone into again a strict lockdown. Will that same thing happen in other places? So pharmacists also have a big role to play against misinformation which is being spread. This is another sort of an epidemic because a whole lot of information through WhatsApp, Facebook has been going around. There are doctors or social doctors or self-made doctors or laypersons who are transmitting this information. So it's up to us to gather the correct information from reliable sources, analyze this information, counterbalance it with the information which is coming in, and provide these things, the correct information and guidance to our patients. Because our patients rely on us, they depend on us for information. We have been their healthcare provider for so long, so they look up to us. Even about immunity boosters, whole lot of market has been flooded with whole lot of immunity boosters. Our role is to study all these things and provide the best guidance to our patients. Then the vaccine, when and how many vaccines will soon come into the market, we have to keep our knowledge up to date for this. And what about will everybody get vaccinated? And will our lives still be normal after the vaccination? Will the vaccine need 2 doses or another dose will be needed? What will be the duration of the control of the vaccine? Will the virus mutate? Or just like the influenza vaccine, influenza shot, will every year a new type of strain of vaccine will have to be produced? So all these things will always keep us busy and active, our minds busy, and always these uncertainties will be there. So pharmacists, all of us have to equip ourselves with all this information. We have to keep ourselves updated about COVID-19 and any other viruses which may be coming in and the mutations which could be coming up. Keep a good track on the vaccine developments, and we will have a very big role to play because people have already started asking us about when is the vaccine coming, how safe is it, because different types of information come at the newspaper. We have an important role to play in guiding our patients about vaccination, about the safety, and of course all the other care to be taken. What is also important is the health of our ourselves as well as our family members in the pharmacy. That is the pharmacy staff with whom we have been working and we have to continue to work. We have to have them in good health, a healthy mind and body, and we have to ensure that their immunity remains good. So for that, we need to continue with our good hygiene practices, personal hygiene, sanitation in the pharmacy, environmental sanitation around our pharmacy, and also in the homes of our staff. Encourage them to have good nutrition and healthy nutrition practices, to have good physical activity and exercise. Of course, those working in the pharmacy are always on their toes, but there would be some who may have to do certain sitting things. But other things like yoga, meditation, they all play a very important role so that our immune system has to remain good so that we in turn can serve our patients. We need to make a have a relook at our long working hours. Should we still continue? Because in some places people continue to work for 12 hours, 13 hours, 14 hours. Many of us don't take holidays. We don't have, it's a common complaint from our families that we don't give them quality time. When did you last take me on a vacation? These are the common things that we get to hear in our home. It is important for our minds, our health, and our family that we also balance our work as well as pleasure. Now, COVID has taken away a lot of attention and lot of our minds and lot of everybody. Now, we should not forget other illnesses also. See, it's whether it is TB or other communicable diseases. And the monsoon comes in, whether it's the communicable disease or mosquito vector-borne diseases, whether it's the chronic illnesses which have not gone away. In fact, they may have been neglected by our patients. They may not have been visiting doctors because many of the times doctors were not in place for quite a few months. Now also many patients are scared to go to doctors. So we need to keep a good touch with our patients and continue to guide them. That yes, they have to keep their diabetes, hypertension, and other illnesses in good control. Then, as Mr. Satish was saying, uh, having handled accidents and emergency cases, we pharmacists should equip ourselves. We have to handle ourselves better in handling minor ailments which come to our pharmacy so that we can handle our patients better. And whatever we cannot do, what is not in our hand, we should know where to draw that line and promptly refer these patients to the doctor or the hospital. Whatever is within our ambit, we can manage. And if we are not sure, we have to pass it on, refer the patients to the doctor. For that, it's very important for us to continue to improve our quality of pharmacy education. We have to equip ourselves, those who have already passed out are practicing pharmacy, through continuing education programs. We need to continuously upgrade ourselves, pharmacy professionals. And now, of course, the digital learning has taken the new way forward. I don't have to go to different places to give sessions, and different session experts don't have to travel anywhere. We all can sit in the comforts of our home or the pharmacy and listen to multiple speakers at a time. This is, I see as a great advantage. I have got to learn so many things through webinars in the last many months, which I would not have otherwise, because would have had to travel and a lot of time, etc. COVID has shown us the way. Let's take the best and the most positive things out of it as the way forward. So some of the things which we should start doing is, since many of the time we are not able to have a lot of time with our patients. Patients sometimes don't have time or they want to run away quickly. Provide them basic instructions about their medication or their illness with whatever minimum time we have. In addition, then we can provide them with dosage labels or dosage stickers, or provide information leaflets with medicine which we dispense to them. And we can use WhatsApp or email or text messages to provide them information. Anybody who's ready, we can provide them telephonic instructions or telephonic counseling. There are some of the patient information leaflet that we have been using, and we are now using them more. Any antibiotic which we dispense, we give this sticker on the right. This is the front and back portion. We write there which antibiotic is dispensed. This is a brief information in additional to our verbal information to ensure that the patient takes the full course of the antibiotic. without missing a dose. These are different, brief, simple information about diabetes, about diet, about cholesterol, pressure, diabetes, in general, what lifestyle modifications to do. And these are labeling instructions, left side, which many of our pharmacies used, and we should continue to do that. We should continue to stress this because still patients come inside without wearing their mask properly. They still continue to touch their mask. So maybe 10-15% of our time of our staff goes in explaining to the patient, please wear your mask properly. But we have to have that patience. And these are different information material for patients about COVID. So the way forward is we have to continue to learn, we have to innovate, we have to go into digital technologies, and so that we can reach out better to our patients, and we have to keep ourselves healthy, and we have to be positive in the good sense that we can all continue to be professional and serve our patients. Thank you everybody for a patient listening, and thank you everyone for giving me this opportunity to share some of my experiences and some of my thoughts and suggestions. Thank you, sir.
Yeah, thank you. Thank you very much, Mr. Raj Vaidya. It's been a wonderful talk that you have given. Real insight into all the activities that a community pharmacist actually does. In fact, really, we all were disheartened throughout the country that when the frontline COVID warriors were listed, the pharmacist was not in the list. But it is the self-satisfaction that matters. It is what we are doing to the community that matters. And let our professional organizations come forward and try to see what best we can do to our fellow pharmacists, whether in terms of taking care of the families of the pharmacists who have fallen prey to this COVID in the fight for their as a warrior, or in whatever terms possible. Let our association, probably Indian Pharmaceutical Association is definitely going to take lead. In fact, they have in their initiative, they have given representations to the central government and the state governments as well to recognize the community pharmacist as a frontline warrior along with the doctors and other professionals who have been listed in that, so that the fatal cases who have lost their lives, they and their families get benefited out of it. So nevertheless, it has been a wonderful talk, Mr. Raj Vaidya. And one point that really impressed me was the role of the pharmacist, the vast areas where we cover, the most important area being the misinformation that is flying. This is where the pharmacist has to come into and try to restrict the misinformation and give the right information to the people and the patients. So I think the voice of the pharmacists have really been wonderful. Two very eminent speakers from the community pharmacist side and one from the regulatory side has really given a very good voice to the activities of the pharmacist. So lastly, I would like to extend my thanks to all the participants who have been here patiently listening to all of us. And what I would like to do is at the end, I will unmute all the participants. And when I say 3 cheers for the community pharmacist, you all just hip hip hooray. You should say 3 cheers, hip hip hooray. Okay. So before that, I would like to present the formal ode of thanks. Our IPA Karnataka State branch has been very pivotal and guiding me throughout to conduct these type of programs. I thank the President, Dr. KRP Shenoy, the Vice Presidents and the other executive committee members who has played a key role in finalizing this program and eventually making it a successful one. I first of all, prominently thank the speakers of today's program, Mr. Raj Vaidya, Mr. Raghuram, Assistant Drugs Controller from Belgaum, and Mr. Satish Savade, Pharmacist from Belgaum. It's been wonderful. Probably, we should have such programs, more and more of such programs in the future, so that the voice of community pharmacists really strengthens up and it really echoes in the central government, so that favorable policies come into the favor of the community pharmacist who's really been struggling and serving the community. So thank you all very much. So I am unmuting all the participants. So 3 cheers to the community pharmacists. Hip hip hooray.
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 3 cheers to the community pharmacists. Hip hip hooray.
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 Hip hip hooray.
Hip hip hooray.
Hooray.
Thank you all. Thank you so much. Please join us.
Thank you, sir.
Also,
Thank you.
and,
Thank you very much.
Thank you, sir. Thank you, sir. Thank you.
and this program is live on YouTube. Anytime you can see it, and it will be available on the YouTube channel. Please tell your other comrades so that they also watch and try to contribute to the profession. Thank you so much.